I wanted to make a video about naturopathic medicine and why people should see naturopathic doctors, but I also don't like to make videos that, in my opinion, are just full of fluff and vague generalities. So in this, I'm going to go through how does a naturopathic doctor really think about these complex cases that come in. A short disclaimer at the start of this video is that not all naturopathic doctors will treat the same way, and that's okay. Some might be better with herbs or homeopathy, some might be better with physical medicine, some might have more of a lab or functional medicine approach, and that's fine. Not everyone needs to do things the same way. My main influences are through traditional herbal medicine, homotoxicology, applied kinesiology, and some functional medicine. If you don't know what all those things are, we're going to get into some detail of it later on in this video. Last point is that there's many things that can come up when going over a case, so I'm trying to give a broad overview. The purpose of this video is not to go over everything that might be included in an assessment. For what sort of client does this apply to? Well, we see all sorts of people in naturopathy, people coming in for all sorts of complaints, but I want to think about the person who, if we look at these symptoms, on screen now, who might have half of them. And when someone is tired or they feel anxious and depressed and they have various pains and digestive problems and they're not sleeping, you can't go in and treat each of these one at a time. That's what conventional medicine does, by the way. Conventional medicine has a subspecialty for every different symptom, and it sends people to this doctor and that doctor, and for each doctor they'll probably get some type of suppressive treatment for those symptoms, but no one is really taking the whole case. Until you go to a naturopathic doctor, that's where we look at the body as one system. And when we review symptoms, we're not simply taking note of, oh, you have this or that, so maybe you can do this or that for that symptom. We're trying to look at what each part tells us about the whole person. I know there are some people who have this misconception, but a naturopathic doctor does not go through a list of different symptoms and say, for this symptom you can take this supplement, or for that symptom you can take this other supplement. That's not why you should pay a naturopathic doctor. You can get the same thing from a clerk at a health food store. When you go through a list of symptoms with a naturopathic doctor, what we're really trying to do is put them all together to figure out the story of your illness. And this is also why we care so much about past symptoms. So for example, if someone had many ear infections in childhood, then as a teenager developed chronic sinusitis in which they were prescribed antibiotics for frequently, and then as an adult gets IBS and candida, we're not going to look at this as different conditions that magically cured on their own and then you got some illness later on. We're looking at this as a progression of symptoms which are manifestations of the same underlying cause. At that chart of progressive vicariation versus regressive vicariation, this is from something called homotoxicology. The idea is that as toxins enter us and become embedded into our cells, it inhibits cellular functioning, and that's called progressive vicariation. And if it gets bad enough, it can lead to cancers and death. Regressive vicariation represents the liberation of toxins from our cells and outside excretion of toxins and healing, and that's called regressive vicariation. So we want to move our cells in that direction of regressive vicariation. We don't want to just watch this deposition of toxicity issue develop, leading us towards cellular degeneration, in the meantime doing nothing else other than trying to palliate symptoms. Symptoms can often be viewed as the body's best attempt to deal with toxicity at the time. So that ear infection that someone has through childhood, well, these minor infections are really a type of detoxification response. So it is a suppression of detoxification that maybe will get rid of a symptom, but later on just replaces that symptom with another one that's even worse as you're pushing the body towards this progressive vicariation. Herring's law of cure was developed by a homeopathic doctor about 100 years ago, and this is a way of looking at how your symptoms change to see if you're getting better, if you're going through that regressive vicariation, or if someone is getting worse. It's pretty simple. As someone gets better, symptoms should leave from top down, from head to extremities. So for example, if someone has eczema or psoriasis, that type of stuff, and it's around their torso, as they get better, it might clear up around that area of the chest and move out to the arms. That's fine. If someone, for example, has Lyme disease and they have joint pain, as they get better, you will see that joint pain leave, but it's probably going to leave, say, their shoulder joint first, and then maybe actually might move down to like the wrist or finger pain. You want to see this movement from top down and inside out. You might see at first deeper organs being affected, like the brain or the heart, but over time, those should get better, and you might actually start seeing superficial symptoms. These are going to be signs of detoxification, whether it might be skin rashes or symptoms of the respiratory system, which might be like a cough or phlegm, things calming out. Also, you might see symptoms calm again in reverse order. So going back to the original example, if someone used to have sinusitis and then that went away, but now they have chronic candida, it might be that as their candida gets better, they might momentarily get sinusitis back again, because the sinusitis was the body's method of going through a detoxification process. And now as they're truly getting well, their body can more fully go through that earlier detoxification process. Now, during a visit, all this underlying philosophy and thought processes probably are not going to be discussed, but it's the type of thing that a good naturopathic doctor is going to keep in mind about how your symptoms are changing and how this relates to the overall story of your illness. Another way of looking at people as an individual is through constitutional signs, and this applies more to herbal medicine. But if we look at things like hot or cold, well, thyme and wormwood, they're both strong antimicrobial herbs, but thyme is very hot, warming. Wormwood is a cold herb. So they're not necessarily going to work just the same in the same person. In fact, I would try to match these up with the right person, which is the point of this. Thyme, if given to someone who has a hot, constitution, may not work that well. That's not what it's good for, because these are not real antibiotics. It's not like you're taking amoxicillin. These are complex, medicinals with many different constituents, and they need to be matched up with the right person constitutionally. And that's the difference between seeing someone who's trained in herbalism and just going to a health food store and buying some candida supplement. Similar thing with dampness and dryness. Marshmallow is a great herb that brings water and moisture to areas, soothes the digestive system. Ginger could also be used for many digestive problems, but it's hot and drying. So if you have a hot, dry constitution and you have like a parched tongue, maybe you don't want to take a lot of ginger. But for some reason, I see a lot of people with hot constitutions either taking lots of ginger or oregano oil, and they're taking it for, candida or gas, whatever. It doesn't necessarily work that well in them. It's not matched with them at all, but they don't think that way. Tension versus relaxation, same thing. On the pictures to the right, the top one is agrimony, there's lady's mantle below. Both are traditionally used for many women's problems like PMS. They could be used for anxiety, insomnia. So if you look at the conditions these herbs treat, they're like the same. But agrimony is for people with a lot of tension, tightness in the muscles. Lady's mantle is you're going to see the opposite. You're going to see a lot of relaxation. So the bottom line is that when you use herbs, there's a difference between using something that's selected specifically for you or just going to a health food store or looking online for something for such condition. Because if you matching the herb up with your condition, you're basically using the herb in place of medication. Whereas if you're using the herb, based upon its overall constitutional effect and understanding you as an individual, then suddenly that herb becomes much more powerful because it's treating who you are. You're not just trying to cover a symptom. We also need to think about how each body responds to stress and toxicity. Some people are almost like overreactive. They'll take a couple of drops of some herbal tincture or one supplement and their body will have this huge response. Other people can take fistfuls of supplements and they don't notice anything. So over versus underreactive, that has to be observed, and that's why these cookie cutter protocols really don't work. Disorganized. It also could be called luetic miasm in homeopathy. That's the type of person where if they take a supplement that does one thing in everyone, it's going to do the complete opposite in them. And that's that type of case has its own challenges. You have to go slow, but you also have to be very specific with them. For someone who's a more disorganized type, you have to be very slow at first. You also have to be careful what you do. You can't do these big cookie cutter generic protocols. If you go to the wrong person, they'll try to do that with these people, and then the person will get an opposite response. So you can start having the practitioner almost like blame them. Well, I do this with everyone else and it works. Why doesn't it work with you? There must be a problem with you. Now, the problem sometimes is that you have practitioners who can't look at people as individuals and they expect everyone to respond the same, even though if you go through the history, then you're going to see that they're not all the same, and you should be able to see these problems coming ahead of time. Because we have mind-body connection as well, pairings of different organ systems with emotions like liver to anger, kidney to fear. That's one reason why I care so much about the emotional stress that my clients are going through, because it's not just affecting their emotions with matters, but it also affects their whole body. As well as we have to consider what specific emotions they have, and there might be emotions paired with specific remedies or herbs. For example, Agramode again tends from acting cheerful despite how she really feels. That's a very specific description. Black Hoa is a good herb for PMS, for women who are like so-called overthinking, always in their head. And of course, there are homeopathics that can also be matched with specific emotional states. Or a classic for depression, feels that lost it all. Not just depression, but someone who felt that they had a lot and now it's gone. Mercurius, ups and downs, bipolar type states. There's a lot more to these descriptions, but when someone gives specific descriptions of their emotional state, that can lead to very specific remedies or herbs. And that's one reason why I always encourage my clients to give me as much detail as they can, or if something pops up into their head that they should mention, that even if it seems unusual, it doesn't seem related to other things, to just bring it up, because it might be an indication of something specific that matches them very well. We can also have specific symptoms from a physical perspective. We can have that, of course, for homeopathic remedies, which you might have several remedies that are used for the same condition, but the overall signs are different. We can see that if we compare Rhus tox to Bryonia, both commonly used for joint pain. From herbal medicine, prominent blue veins matches lady's mantle, sweaty palms, lemon balm, hard lymph nodes, red clover, soft lymph nodes, poke root. This is again why when I'm with someone, I want all the specific detail, because it really does help me figure out what they need specifically. So when someone comes in with multiple symptoms related to many different systems in the body, you take the history, you look at what each symptom says about the overall story of their illness, and that leads towards specific action. Because you can't look at all these different systems and say, well, you have this going on here, that going on there, and then try to treat each individually with the herb that's supposed to work for, irritable bowel, or then the herb that's supposed to work for the urinary tract, and so forth. You end up telling people to do, 15 different things, and none of it's going to work that well anyway. Tongue analysis is something else I use. We can see that these are all rather different, and they're not going to respond to the same herbs or the same treatment the same way. But tongues actually match up well to a lot of the constitutional signs that I look for. So for example, the tongue in the middle with that crack down the middle, that shows dehydration. And then the one on the right has some red dots on it, which is showing heat and inflammation. So that can point to the right herbs that are reflective in the problems you see in the tongue. Because the tongue is interesting in that it's the only place in the body where you can look at the muscles directly. Other than case history and those constitutional signs, we do care about lab tests. Something you should just never bother doing with a naturopathic doctor is telling one of us that someone else said your labs are normal. Whenever I get that, I really don't know what that means. We have optimal range of labs versus reference range. So for example, the official reference range of TSH, or thyroid stimulating hormone, is 0.4 to 4.0. Optimally, it's more like 1.5 to 2.5. Or if we look at eosinophils, that's a type of white blood cell that's elevated with allergies or parasites. The official reference range is 0 to 8%. Optimally, it's less than 3%. So often there's a lot of information just on your conventional labs that you might have been told is normal that's not normal. In addition to looking over conventional lab work, many people in natural health will use these functional lab tests, and these are through labs such as Genova, Doctor's Data, Diagnostics, some specialty labs that have tests that aren't so much designed to figure out the conventional diagnosis, but they're designed to test for the underlying function of the body. That's why they're called functional lab tests. There's a lot that can be tested for in stool that typically you're not going to get from a gastroenterologist. I know it's kind of annoys me when people come in with digestive problems and I've asked if they've had any stool tests done, and they're like, oh yeah, my doctor did it, and the only thing that they had tested was just for like 1 or 2 parasites. So through a functional stool test, you can be tested through parasite on microscope, but they can also test IgA antibodies against parasites, where they're much more likely to come up, because parasites can be very hard to see visually. You can look for markers of inflammation in the large and small intestine. There are IgA tests against food allergens. You can look for markers of pancreatic enzyme production. They can look for yeast, pathogenic bacteria. There's a lot of information about digestive system function that you can see on a functional lab test. But the way it is in conventional medicine, they only look for a few parasites, and then it's like, oh, off to a colonoscopy, or off to get an endoscopy. I'm not saying people shouldn't ever have those tests done, but there is another option between saying you're okay or let's do a colonoscopy. Toxicity, you can't test for toxicity that well in blood unless someone's acutely poisoned. I will typically use hair analysis or porphyrin testing. It could be tested in urine or stool tests, but even the urine and stool, you're only going to see it if someone's actively doing something to detoxify their body from it. Otherwise, there's very low chance of seeing anything there. Hormones, saliva, cortisol, female hormones, male hormones. So those can be tested as well. Usually they're not tested that well in blood. There are food allergy tests, because people are always trying to figure out what type of food allergy that they have. Often people will tell me that they got food allergy tests from their medical doctor. The skin prick test that the MDs do, that's good for testing IgE allergic responses, but there are many delayed food allergy responses that's not going to pick up on. And that's why we have blood tests for IgG antibodies, because those are going to be the delayed food allergy responses. There are other ways to test for nutritional status, minerals. Usually I use hair analysis for that. In other states, like outside of New York, other naturopathic doctors will have like different blood tests from specialty labs to look for minerals. Amino acids, organic acid testing, that's another type of functional lab. Don't use those that often, but if someone needs a comprehensive way to actually test for amino acid or vitamin nutritional status, those are out there. The other thing I use to figure out what's going on with my clients is muscle testing. This can go by different names. It can also be called applied kinesiology, touch for health. You'll see different systems that use muscle testing, like neuro-emotional technique or nutritional response testing. But it's pretty simple way of assessing what's going on in the body. From a very simple perspective, different organs are going to be paired to different muscles. So the liver is paired to the pectoralis major, which is the major chest muscle. And if that muscle is weak, then it can show that there's a problem with the liver. Or if the deltoids, which raise the arms, are weak, that's paired to the gallbladder. And there are many more pairings of muscles to organ systems than I have on this slide. But once you have a good indicator muscle, then you can do all sorts of challenges against people. You can challenge different organ systems. You can challenge people against different toxins, like using different vials to test them against mercury, aluminum, lead, to see what their body's saying, no, I don't like, I'm not in resonance with this. Technically, this is not a diagnostic test. So, for example, a urinary metal test is testing to see how much of mercury you're peeing out. If someone does a manual muscle test and they say, well, you're testing weak against mercury, like you're dropping against a vial, then that's showing a lack of resonance. Technically, that's not a diagnostic test, but we're getting information of what your body's okay with and what it doesn't like, and this can be used in conjunction with the rest of the assessment to put together a better plan. I could do challenges against candida, different foods. So just in the office, I can find out a lot of information. And then if there is additional information that we need from lab tests, then those are brought in. It's not an all or nothing thing. Just because I might use this applied kinesiology technique to challenge people against toxins doesn't mean I'm opposed to actually doing a lab test for toxicity. It's about getting as much information as we can from different sources. There are some treatment uses for applied kinesiology, neuroemotional technique. That's one system to help relieve different types of emotional stress. neurovascular points, neurolymphatic points. So there are different areas on the body to locate that relate to these organ systems that we can find using muscle testing and stimulate those to help organ system function. But also, once we find a weak system or we find some type of toxin that the body doesn't like, then it can be challenged against like herbs or nutritional supplements to find out which ones the body is in best resonance with at the time. So the idea is not to guess in terms of what types of herbs or supplements someone might want at the time. Whether it's looking at the specific symptoms, the constitutional signs, the conventional lab test, the functional lab test, the kinesiology, it's all about figuring out who you are as a person and what you need in this moment. We always need to keep in mind that the body will prioritize the acute. The example here is someone who has a broken bone but also Lyme disease. Well, yeah, they have Lyme disease, but their body might start putting its energy towards healing the broken bone. So there might be problems going back through your past that we'll see on the history, that we'll see in the progression of your illness. That doesn't mean that we can say, well, we're just going to treat the cause and go all the way back to a problem that happened 30 years ago, because you kind of have to meet the body where they are now. So it turns into a process of layering, where someone comes in with their acute presentation, and then there's the chronic problem. And as you give them what they need, you're going to start seeing relief with the acute presentation, but then later on, you can slowly work on the more underlying problems. So for example, going back to the earlier case, if someone used to have ear infections and sinusitis and eventually got candida, then yeah, when they come in, you're going to try to work with where they are now, because they have candida symptoms. They might have brain fog and fatigue. They might have even muscle pain from candida if it's bad enough. So the treatment is going to be directed at where they are in the moment, but at the same time, you think about the overall long-term plan, because you know it's not just about killing candida, it's about the environment that allowed candida to grow. It could be related to diet, but also be related to things like lead and mercury. And it's about using therapies that aren't there to just kill candida or suppress the problem. It's about using therapies that will, help in the short term, but also in the long term help the body to expunge candida as the underlying problem goes away. We're not about moving symptoms around. We're about moving people towards being truly well. All of this might be a little overwhelming, but if we step back and look at the general causes of illness, then we can see that's kind of simple also. With deficiencies, toxicity, emotional trauma, and physical trauma. Those are the things that cause illness. And that's it. There's some genetic issues, but for the most part, the genetic stuff is way overrated. Today, we're even finding, and the more they look into this, the more they're going to say, someone might have a genetic predisposition, but it's going to be the deficiency, toxicity, emotional trauma, and physical trauma that turns the genetic disposition into an actual illness. So naturopathic doctors have a large toolbox, but it's not really the toolbox that defines us for who we are. What's more important is the overall naturopathic philosophy. So I did not make this up. This is the 6 principles of naturopathic medicine. You can find it all over the internet by just searching for what naturopathic medicine is about. The healing power of nature. We trust that the body knows how to heal if it's simply given the tools that it needs. We want to identify and treat the cause. That's because if you use agents that suppress symptoms, if we don't work with the body by suppressing symptoms, we're actually suppressing the healing power of nature. We're actually suppressing the body's attempts to heal itself. So we're always looking to work with the body on the more causal factors. First, do no harm. That should be pretty obvious. And that's one of the advantages to using natural therapies, in that they don't have all the toxic side effects that pharmaceuticals are trying to force the body to do something will have. Of course, even if you are using natural agents, it doesn't mean that there is no harm. You can go out and eat some belladonna and that can kill you. So you still have to know what you're doing and think about the overall systemic effects. Doctor as teacher, patients should be educated into how to maintain health instead of just having the doctor as some authority figure who bosses someone around. The whole person needs to be treated. You cannot just cut off little body parts and treat those in isolation. That's why, in general, naturopathy is not about subspecializations. It is just about treating the whole person. And finally, prevention, because if someone comes in before a problem really manifests, we can do a lot to prevent it rather than just doing watchful waiting. Thank you for watching. If you have any questions, comment below or send me an email. Here's some links to some other videos that I have. And I guess that's it for now. I truly hope that this has been educational for people and more than just a promo video. Okay, bye.